We are live.
Good evening, everyone. On behalf of NASH 24 into 7, I welcome you to our public awareness program on Defeat the Silent Killer, NASH. NASH 24 into 7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. To speak on the topic, today we have a renowned gastroenterologist, Dr. Prerna Pallavi from Durgapur, West Bengal. She needs no introduction. However, I would fail my duty if I don't mention that she is a leading gastroenterologist in Durgapur, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. She is having over a decade of experience building a clinical skill set that allows her to deliver patient-centric care. She is a consultant gastroenterologist at Healthworld Hospitals, Durgapur. We salute her dedication towards spreading awareness related to liver health and disease. So without taking further time, I invite Dr. Prerna to speak on the topic and enlighten us. Over to you, ma'am.
Good evening, everyone. Thank you so much. So, to our topic of discussion, without wasting much time, I would like to go ahead with our topic because NASH, it is a very important topic and a leading silent killer these days, and it definitely needs a special mention and discussion to raise awareness and prevent people suffering from this, to decrease both morbidity and mortality. So we will start with our presentation. Although it will not be just a monotonous discussion, I will be dealing with the important points, and accordingly, if there are any questions, we can discuss this. So without wasting much time, first to move ahead.
Just click on the screen, then change.
So why we are celebrating this International NASH Day? It was initially like we have many World Hepatitis Day, we have World IBD Day. Then in the same way, NASH has become a global epidemic in the past few years with the changing lifestyle and with the changing food habitats. So this has gained recognition because more people are becoming diabetic, more people are becoming obese. So this was launched in 2018 by the Global Liver Institute and celebrated across the world on second Thursday of June month. So it is basically to raise and create awareness among the people for timely intervention and get diagnosed at an early stage. So every program has a theme for every year. This year we had the theme Step Up for NASH. So the Global Liver Institute is inviting all of us to step up for patients, to step up for early detection, to step up for advocacy to defeat NASH. Together we can, only together we can. So there are various drugs to reach out for it, although dietary and modification and exercise are the primary thing, but then definitely drugs do play a role. So our official partner, Zydus, they have been doing various awareness activities so that we can reach out to people and spread timely awareness. So just a small introduction about the liver. As all of us know, liver is the second largest organ of our human body. It is located in the right upper quadrant of the abdomen. And the basic functions of the liver are mostly it is to process the nutrients and help in digestion. And it bears the brunt of taking all the toxins, also all kind of junk food we eat to further digest and process it. And apart from that, it also produces bile and detoxes our blood. All junk food, alcohol, medications, everything gets metabolized in the liver, and then further excretion is through the kidney. So it holds various metabolic processes which happen in our body. And non-alcoholic fatty liver disease, as we all know, alcoholic fatty liver disease was once very common, but now Non-alcoholic fatty liver disease is taking over. And what is that? It is basically the deposition of fat in the liver, that is more than 5% of the liver weight is occupied by fat. Left untreated in the initial stages, it is just fatty liver. If we leave it untreated, then it progresses to NASH. What is NASH? Non-alcoholic steatohepatitis. So in simple terms, the fat starts damaging the liver. So what are the risk factors? Basically, the risk factors are the persons who are first and foremost. Then second, we have various metabolic disorders which we do not have control over, like diabetes, raised cholesterol levels. Even lean people can get NASH. So it is not like only obese people will get this. And the male gender has been considered as a risk factor for progression to NASH and fibrosis. As I have already discussed, that 3 out of 5 people are diabetics these days, and 6 out of 10 diabetes patients suffer from fatty liver disease. The representation to show how it progresses. The healthy liver is a very shiny liver. Once the sharp margins turn round, and then further the normal liver, which is very spongy, becomes elastic. And then further damage, if it occurs, then it becomes nodular. As we can see, there are round nodules over the liver. So the difference between fatty liver and NASH, just simple deposition of fat is fatty liver, but then the damage starts occurring in the liver, and we see it in the form of deranged liver function test. So that is known as steatohepatitis. Further, how it can be proven? By doing a biopsy and seeing under a microscope. So as I have said, the various risk factors, obesity, the genetic background, the food intake, which has happened, the physical inactivity post-COVID, this has increased a lot, like work from or being inactive has become a major predominant factor for fatty liver. Then being exposed to certain medications and metabolic syndrome. What do we mean by metabolic syndrome? People who are obese, who have diabetes, they have raised cholesterol levels, and then further they go on to develop fatty liver disease. So obesity and fatty liver disease go hand in hand. Not eating, the branch goes to the liver. Obesity increases the amount of fat to 10%, and further starting the liver. Diabetes and fatty liver disease, they have very high association. Like these days, many people come to our outdoors also with bloated abdomen. I mean, पेट फूल गया है, पैर फूल गया है. There is jaundice. And then when we take the history, 60% of them are non-alcoholic. They have never taken alcohol in their life, but yes, they are diabetic. And because of diabetes, they had fatty liver, which was not recognized in the initial stages. And then the damage continued and then further led to liver cirrhosis. Liver cirrhosis in simple terms is liver failure. Like we say kidney failure leading to dialysis, the same way liver failure ultimately leads to cirrhosis. There are no symptoms as such of NASH. It has to be timely diagnosed only by the physician, because once there are symptoms, it is already too late, because the symptoms are mainly of cirrhosis of liver, and cirrhosis is end stage disease. That is, once the liver cell failure occurs totally, then only we get symptoms. In the initial stages, you will have just right upper abdomen discomfort. There might be fatigue, there might be weakness, and apart from that, you won't see anything. And that is the reason most of the people do not get it treated. They say, मुझे तो कोई problem नहीं हो रहा है, मैं क्यों इलाज कर रहा हूँ? But then, you know, when it progresses, then it will go on. They will go on to develop over a period of 5 to 10 years NASH, and then So cirrhosis has varied range of symptoms. They may have fluid in the abdomen, that is water. They may have jaundice. They vomit blood. They may pass black stools. They might be confused. They might be lethargic. So these are the various symptoms. And then it is so diagnosis of fatty liver, these days doing ultrasonography is a very simple thing. We have ultrasonography. There is a diagnostic centers in every town, every village. So diagnosing it is not a big thing, but then when to start the therapy, that is very important. So you have to be in touch with your clinician so that timely intervention can be done. It is because it is a silent killer. It is going to be the next epidemic, that is the fatty liver disease, because of the predominantly changing food habits in our society. So it has to be diagnosed. And what are the ways with which we can diagnose? Blood tests. These are again very simple, available at every nearest lab. You can just get it done, ask liver function test. Then the next level is doing an ultrasonography. And if the condition warrants, if the clinician feels necessary, then we will go for further intervention and diagnosis, that is in the form of special ultrasounds of the liver, that is fibroscan, or doing a liver biopsy, or doing an MRI or CT scan. So as I said, liver function test, LFT as we commonly say, the SGOT and SGPT levels, we have to see that, and the interpretation of it, you have to self-diagnose, obviously. Once you get your test done, please contact your gastroenterologist or hepatologist or your physician so that you can ask for a timely intervention and a timely therapy. Using these blood tests, so various scoring methods are also available with which we can diagnose at what stage you are and what kind of drug therapy do you need. There are various scoring systems, as I said. There are various online tools also available using the blood reports and the body parameters with which we can calculate this. The non-invasive methods, as sonography and the blood test suggest that you are suffering from a non-alcoholic steatohepatitis, that is in short term. We will further test in the form of ultrasonography or fibroscan. The disadvantages are these are just the screening tests. They are not the definitive test to tell what is the amount of fat accumulated, because ultrasound can detect fat only if it is more than equal to 25%. Cannot differentiate between fat and fibrosis. That is what is the stage you are going on. That is not possible with a simple ultrasonography. So if the symptoms or the blood reports are alarming, they definitely need further testing and evaluation. Next is the fibroscan. These days, fibroscan is also being available at various centers, but people need awareness. That is, fibroscan is not supposed to be done in each and every patient, but yes, once the blood reports are abnormal and the ultrasound reports warrant, then definitely fibroscan is necessary to know what is the amount of fibrosis which is going on in the liver. Again, obese patients, kids, these days kids are also getting affected by fatty liver disease and developing NASH. So this is starting at a very early stage. So by the time people come to 40s and 50s, they are tend to develop cirrhosis of liver. So transient elastography, liver scan, this is a very special ultrasonography of the liver, I can say in simple terms. We get two values from this, that is the liver stiffness measurement and the CAS values. These are very, very helpful again in treating the patients and for follow-up purpose. Next is the MRI proton diffusion scan. So this is the gold standard to detect, but it is not available at all the centers and is very costly. It can detect fat as low as 1%. So it is mainly used at liver transplant centers. That is, whenever someone is planning to donate a liver to a relative or someone, then before giving the liver, before taking out the liver, this is widely used to see whether the donor liver is fit for donation or not. The invasive test, liver biopsy, still remains the definitive test. That is, we take out a piece of liver and see what is the amount of damage, what is the amount of fat accumulation. So this is the gold standard only method to diagnose now non-alcoholic steatohepatitis. And apart from diagnosing NASH, we can also see whether any other conditions are affecting the liver or not. The only disadvantage is that it is a very painful test and individual dependent. The chances of misdiagnosis in early stages are very high. So the simple fatty liver disease, most of the times it is just isolated fatty liver disease. You just have to do dietary restriction and do moderate exercise. There is no increased risk of death. Only 20 to 25% of the patients who have fatty liver on ultrasonography go on to develop non-alcoholic steatohepatitis. That is, they develop blood test abnormalities, and over a period of 10 to 15 years, they go on to develop complete liver damage, that is NASH, cirrhosis, or liver cell failure, and then develop decompensation, that is develop fluid in the abdomen, or have blood vomiting or black stools. And among them, 7% may develop cancer, that is hepatocellular carcinoma, liver cancer. So the increased risk of death in these patients, that is patients who have non-alcoholic steatohepatitis, fatty liver is there, fat gets accumulated in the liver. So it's not just that it is getting accumulated in the liver. They will have other organ damage also. And even in them, the primary cause of death is cardiovascular, and second is malignancy, and third is liver related. So any patient who are having heart attack, coronary artery disease also may have concomitant fatty liver, or who have fatty liver, they are at a very high risk of developing coronary artery disease. So it is not like that we are dealing with only one organ. The entire body is getting affected. So we have to act before it is too late, because progression of NASH can also increase the risk of heart-related diseases. So non-alcoholic steatohepatitis is a more severe form of fatty liver disease in which we have scarring of the liver, and NASH may lead to cirrhosis or liver cancer. Severe NASH is not reversible. We can only keep in control. Like once we are diabetes for life. Once we are hypertensive, we are almost hypertensive for life. Once we are hypothyroid, we are hypothyroid for life. So once we have severe NASH, we have severe NASH for life. We have to take care of it. We have to be on regular therapy. You just can't escape by saying that I don't have any symptoms, so I don't need to take care of my disease. So what is the form of therapy? Initial, first and foremost, is dietary restriction, and then exercise, lifestyle modifications, and the drug therapy. So dietary restriction is the foremost, but only dietary restriction will never lead to weight loss or reduction of fatty liver. It has to be combined with exercise, and if in severe form, the drug therapy is a must. So it should be a hypocaloric diet with the exercise, moderate exercise, that is at least 30 to 45 minutes a day, 5 days a week, and intense diet. Means it should increase your heartbeat. It should be a moderate intensity exercise, and the target should be at least 3 to 5% of body weight reduction. Will improve ketosis. And if you have NASH, the target should be reduction of body weight by 7-10%. So weight loss effect on fatty liver disease, that is for fibrosis reduction, the weight loss should be more than equal to 10% at least. For NASH, as we have discussed, at least 7 to 10%. And just fatty liver, 3 to 5% body weight reduction will do. So what are the diet? As I have already discussed, it should be small, frequent meals. It should not be like eating, just eating 2 times in a day, but then eating like a king, sitting with all kinds of food and then eating everything. So, and then telling मैंने तो सिर्फ 2 बार खाना खाया. So that will not do. You will have to take small, frequent meals. The sugar, carbohydrate portion should be relatively less. The fat containing product should be relatively less. The types of exercise, only aerobic exercises can help, or the resistance exercises in which you lose your calories. So they help in reducing the liver fat, may help in maintaining the healthy body weight, and also improve the cardiovascular conditioning. So the basic, apart from that, we have various lifestyle tips also, that is getting enough nutrients, vitamins and minerals, getting regular checkup, eat small frequent meals, reduce the amount of sugar intake, develop a regular exercise habit, and get enough sleep. Now the drug therapy, this has to be under the medical supervision. It cannot be self or over-the-counter medicine. So we have various forms of drugs. Various anti-diabetics are being advocated these days. They help in reducing the insulin resistance and then further reduction of fatty liver or the body weight. NASH with or without fibrosis, in both diabetic and non-diabetic patients, these anti-diabetics can be indicated. So you can ask your doctor definitely that, because these days people are becoming more aware. They search their drugs over the Google and then come and say, "Mujhe to sugar ka dawa de diya." So you need to discuss this with your doctor before starting your medicines, or before stopping it on your own, that what is this and what is it for. So and then only you can have a healthy doctor-patient relationship, and then develop trust over your doctor that yes, whatever is being done, it is for the good of my health and liver. Initially, the minimum duration of therapy is around 1 to 2 years, and after that, once the condition can.
Ma'am, you are not audible.
Ma'am, please continue.
Yeah. Slide.
Just click on the just yeah.
Okay. Anyways, we will. So the main agenda is to develop a healthy lifestyle, and then focus more on body weight reduction with dietary modification. The dietary modification alone cannot control it. So it has to be in combination. And timely intervention, drug therapy is a must so that the progression of liver damage can be stopped.
Yeah, thank you. Thank you so much, ma'am, for this wonderful talk. This has enlightened all of us regarding liver health, fatty liver, NASH. And with your permission, I would like to ask the question which is from the audience, that I am not obese and diagnosed with fatty liver. So should I also go for weight loss, and what are the diet recommendation for the same? Yes, ma'am.
Yeah, this is a very appropriate question, that you're not obese but has fatty liver. So as we have discussed that fatty liver can be simple fatty liver. So simple fatty liver, yes, definitely. If you're not obese, the obesity does not just mean that you have you are overweight. You can have abdominal fat also, and in fact, there is another term that is called lean NASH. Few of the patients who are diabetes, who have diabetes at a very young age, so even they tend to develop fatty liver disease and then go on to develop NASH. So in such cases, only the weight loss is not the primary target. In them, the mechanisms are different because you have metabolic disease, so the liver is getting affected. So dietary restriction, yes, definitely it is a must. And if your body weight is appropriate, still doing appropriate exercise to maintain proper body weight is a must, and then you will need drug therapy.
Yeah, ma'am, the next question is, you told that diabetic people are at risk of developing fatty liver. So fatty liver patients can also develop diabetes, or what is the relationship between these two?
Yes, very appropriate, as we have seen in the slides or while we were discussing. I have said about metabolic syndrome. So diabetic patients, in fact, those who are diabetes, they over a period of time go on to develop fatty liver disease, and then that fatty liver disease progresses to NASH and then cirrhosis. So this is one entity. Second entity, as I have said, in kids. So these days, eating junk food, that has become a very, having snacks and eating junk food. So this has become very common. So young age patients who come to us, they are obese. So they are going on to develop metabolic syndrome. So they are first obese, and because of the obesity, they develop insulin resistance, they develop high blood pressure, they develop sugar, and then with all these, they have fatty liver and NASH too. So it can be vice versa. Diabetes leads to metabolic alterations because there is derangement, fat metabolism gets disturbed, and because of that, there is deposition of fat in the liver. But people who become obese, they go on to develop diabetes and NASH. So the cycle gets completed both ways.
Okay, ma'am. Ma'am, one more question is there. Can a cirrhosis patients who have undergone multiple times banding of liver reverses his liver health?
Sorry, who have undergone multiple banding?
Yeah. Cirrhosis patient undergone multiple times banding of liver can reverse his liver health. So he's asking.
Most of the times it is no. Only few patients who are alcoholic liver disease, like who have taken alcohol, and if they just have varices, they have not yet developed any other complications. In them, there are 30 to 40% chances of maintaining it and getting it into a fatty liver stage. Otherwise, most of the cases, the further damage can be prevented, but then the 100% reversal is not possible.
Correct, ma'am. And one more question is there. How long these medicines for fatty liver continue? Will it be continue for lifetime like diabetes and hypertension?
As we have seen, the minimum duration of therapy at least 6 months to 1 year. And after that, once the biopsy, if biopsy is done and if biopsy is suggestive of a complete reversal or it comes to a very initial stages, then the medicines can be stopped. If the damage or the fibroscan values have already exceeded a certain level, which we can see clinically after seeing the blood reports and the imaging studies, then in few cases, it is to be lifelong.
Okay, ma'am. Yes, I think no more questions now. So, ma'am, on behalf of NASH 24/7, I thank you for this lively and informative talk. And you have been emphasizing the awareness for liver health and disease. It is also important for people affected by this fatty liver or NASH NAFL to regularly visit the doctor and continue the medications and lifestyle modifications. With careful observation of precaution, it is possible to obtain the control of this disease. And I would also like to thank our audience for their active participation. Stay connected with NASH 24/7 on Facebook and YouTube, and take care of yourself and your family members. Thank you once again to Dr. Prerna Pallavi, who has given her time today for this important patient awareness session. Thank you. Good night.